there was a stand-up comedian and he said कि तुम radiologist हो, तुम अपने आप को doctor बुलाते हो.
We might not be patients' doctors, but we are doctors' doctor.
Do you think doing CPS radiology can also make you a skilled radiologist?
Yes, personally, I would not suggest anybody to take CPS.
Finances as well. Which machines are the least possible things that we require to actually start a radiology setup?
So the minimum that is required, like I said, X-ray and ultrasound is the minimum that should be there.
I have heard that it's one of the most chilled branches, but people still report that some kind of toxicity is still there.
Toxicity comparatively is definitely less as compared to the clinical branches. But then, of course, like I said, it varies from institute to institute.
How we can actually help them reduce the toxicity and encourage our students to come together and fight these kind of things.
So थोड़ा सह लेंगे, attitude is good. But at the same time कि बहुत ज़्यादा सहन करना पड़े, that should not be the case.
And what would be your advice to the students? The kind of students who have not done anything till now, they want to start. Do you still think they have a chance? We are on a mission to build India's largest community of medicos. And because of your love, we are actually able to start this mission. And I would like to give my sincere welcome to each one of you for making this channel a success. Everything is because of you. So for today, we have a very interesting guest. She has been an all-India topper throughout her life. She is an MD from Sion Hospital and MD Radiology from prestigious Nair Hospital of Mumbai. She is a national level postgraduate teaching faculty and she is the founder of MedSynapse Academy. And I'm sure you must have guessed it by now. She is the legend Dr. Nikita Nanwani. In today's episode, we are going to talk in detail about radiology decoded, I would call that. How much radiologists can earn, the money, the capital, the infrastructure required for making a radio lab, what all is required to become the best radiologist in the country, and is radiology the branch for you or are you just under peer pressure? We are going to talk about each and everything. So let's put our hands together and let's welcome Dr. Nikita Nanwani. Welcome, ma'am, to the Nachiket Bhatia Show.
Thank you so much. It's an honor to be here.
Thank you so much, ma'am, for these kind words. So, ma'am, we all know that you are a very respected face in the field of NEET PG coaching. You are a revered radiologist. So, before we move on to the the grandeur part, we want to know everything about the beginning of Dr. Nikita Nanwani.
So, Dr. Nikita is a person who's from a very humble background, but who has been instilled since childhood, this feeling of believing in your potential and giving in your best in whatever you do. And that has been instilled in me by my mother right since the childhood. So since childhood, I've always been this, one of the topper students in the class, and that has continued forever, I believe. And so basically I did my MBBS from LTMMC Sion Hospital, Mumbai. And then having secured a great rank in PG entrance, went on to pursue MD Radiodiagnosis at Nair Hospital, Mumbai.
Ma'am, what was your rank?
So I got a rank 10 in Maharashtra PG CET, and which was very, very unexpected. I mean, top 50 was expected, but getting a rank 10 was very unexpected.
So, ma'am, the most basic question would be that why did Dr. Nikita actually chose medicine as her career? Why not anything else?
See, we belong to the generation where it was meri beti ya to doctor banegi ya engineer, and I was always more inclined toward medicine and not engineering, because you have that generation again ki meri beti doctor hai, that of course my mother also had. So I always wanted to do that. That was the very reason.
Ma'am, you chose radiology as a career option for your post-graduation. So was it peer pressure that a topper has to choose radiology, or was it a very observant decision of yours?
No, I'll be very honest. I mean, the year which was 2012 when I gave my PG entrance, I think that was the year around, like just before that, when the topper started choosing radiology. Radiology was never on my mind till the result, like that rank 10 came. And only when rank 10 I got, and everybody around, the seniors were like, you are getting radiology, you should not leave it. And that definitely, changed the decision there. But I always wanted to choose a branch which gives a good work-life balance, plus helps me pursue my, like I said, the academic incline, always wanted to be an educator. So, that is where I thought that radiology fits in the best.
So how's radiology been for you? How's the career?
Radiology has been very good. Like whatever I thought, it definitely gives a good work-life balance, and helps me to manage so many things with the option of working from home. So it has been really good, but the only the disadvantage I would talk about is does not give that much of patient interaction or that clinician wala satisfaction which is there. But yes, so far so good.
While talking to you, I'm just remembering there was a stand-up comedian who was talking to the audience doing some crowd work, and he said कि तुम radiologist हो, तुम अपने आप को doctor बुलाते हो. So,
Glorified photographers,
yes.
right?
So what's your opinion about that?
See, I mean, that's a misperception amongst the non-medicos, specifically if I talk about, because even I face this. I might not be a doctor for the people around, because उनके लिए ये होता है कि जो patient treat करता है सिर्फ वही doctor है, right? So that is what the non-medicos think. But if you actually talk about it, radiology is the crux, the spine in the patient management, right? No diagnosis, no treatment. Early diagnosis, early treatment. So that is how it's very, very important. Until unless there's no diagnosis, the treatment does not go ahead. So radiology forms the spine in the patient management. Though, it's like a movie. You might not be the actor, the face there, but you are the director who's actually directing the entire movie. So I would say radiology is like that, being the director in the movie of the patient's life. Yeah.
That's true. People who are not able to see that who is actually the brains behind the scenes, and radiologists are one of the best in that particular, field, I would say.
Yeah, true. So that is what I would also like to add on. Like, we might not be patients' doctors, but we are doctors' doctor.
Ma'am, do you miss the clinical interaction with the patients?
Honestly, yes. But thankfully, personally for me, I'm a person who loves ultrasound more than CT and MRI. Right? CT and MRI is something which is you're more confined to one room reporting, but ultrasound is where you're doing it yourself. So that's the time you can interact with the patients. And I think that is what I personally love, and that helps me to get the patient interaction.
I think that's one of the biggest concerns whenever a student is actually, talking to me, that if they want to choose radiology, government or private, their biggest apprehension is that they will not be getting that kind of, clinical engagement with the patients. And the second most is that, in their mind, behind, somewhere in their mind, they are thinking that AI will actually replace radiologists in upcoming 10 years. Now, that's a big question for today. So do you think that will happen?
I don't think so that AI will replace radiology, but definitely it would assist radiology is what we can definitely talk about. Because if there's a report which is being made by AI, for example, but it will never be issued to the patient without a radiologist sign. Because who would take the responsibility if the report goes wrong, right? So radiologist, definitely the role would be there. AI would rather help us in accelerating the process on the reporting. Right? So rather than just being the bystander, radiologist actually, should be the leaders in the innovation of getting AI in assisting radiology.
So there's one big fact about radiology, that it is the highest paying branch. People are not able to understand how that is, because they believe once they take radiology, they will be getting superb offers throughout their lives and money will never be a problem. Now, I will ask you as a radiologist, as an educator, now, is that a fact or a myth?
Absolutely. So that is what I wanted to say. It's more of a myth, right? You just do radiology and you would earn like anything which no other branch would earn. That's absolutely not the case, right? I would definitely like to tell the students who choose their branch post PG entrance, never choose a branch like radiology just because you think कि पैसा ही पैसा है. ऐसा बिल्कुल नहीं है. Money is always the byproduct of something that you are doing. If you're skillful at that, you would earn in any branch, right? So radiology definitely has better job prospects because, like I said, diagnosis forms the spine in the patient's management. It gives you good earning potential initially after MD, but then it has a plateau also when you are in a job, right? It's not going to increase beyond a certain limit. But yes, if you have your own center, then the sky is the limit, right? But in that case also what happens is the maintenance of the machines, the cost that is involved in setting up the private practice. I'll tell you about one of my friend who does make 30 lakhs a month having his own private center, right? अगर आप सिर्फ ये देखो कि 30 lakhs a month, तो आपको बहुत ज़्यादा लगेगा. But then when I actually talk to him and realize, he says hardly महीने के 5 लाख बचते हैं because everything goes into the maintenance, the EMIs, the salaries of the staff. So I think it's more of a myth, I believe.
For a radiologist, when after post-graduation, there's a big question mark that what is supposed to be next. All right. Normally when people take radiology, they believe that it's an end branch. I personally believe no branch is an end branch now. People are demanding super specialization in the form of an, DMMCH or fellowships or other avenues. Now, after a radiology post-graduation, what do you think is the best possible options for further education?
Radiology residency is something, first of all, when a MBBS graduate enters radiology residency, it's absolutely new. फर्स्ट ईयर तो सिर्फ समझने में चले जाता है कि हो क्या रहा है, राइट? सो द 3 years of MD radiology or DNB radiology does not actually make you a very good radiologist that you can just go ahead and report by yourself. So personally, I believe that the best thing would be to hone your skills by doing senior residency in one of the good institutes. Even though you might not have done your PG from a very good institute, you can always compensate for that by doing the senior residency in the best institutes in the country that we have, or maybe doing fellowships abroad. That also helps. So honing the skills post-MD is something that should be done.
And what are the possible options after post-graduation?
You have musculoskeletal radiology, then you have OBGY, women's imaging, which is there. There's neuroradiology, cardiac imaging, body imaging, and the list is endless. See, everybody has to choose it based on their interest. Like I said, personally for me, UST is what I find better. Somebody else would find cross-sectional imaging better. So they have to make the use of that 3 years of residency to realize what I am liking personally, and then just follow that. Do not go for the herd mentality. Ki this is what is everybody is asking for, so let me do it. Just follow your heart, follow your passion, and you would be great in life.
Is there any super specialization degree also available apart from the fellowships?
Yeah. We do have DM also after MD or DNB radiology. Like we have DM in interventional radiology, DM in neuroradiology, DM in cardiac imaging and intervention. There are 3 DMs available which are there, right? Mostly in the central institutes like you have AIIMS, PGI, JIPMER. So we have DMs available in those.
Which sub branches of radiology do you think will have the highest potential upcoming 10 years?
See, honestly, again, I would say every subspecialization is the need of the hour, right? I cannot pinpoint which subspecialization will have the highest potential, to be very, very honest, because everything is required. Just that, but somebody who has a subspecialization will definitely be the need of the hour.
What do you think about courses like FRCR?
Oh, yes. See, FRCR, when I was in my residency, not everybody used to do FRCR. It has become the trend now, and it has now become the need of the hour. So for the generation who's doing residency now, if you're going to apply for the job after MD, DNB, if you have your competitor who has MD, DNB, FRCR, definitely gets an extra edge. So that's why it's very essential, for the residents to know that they should give FRCR. It opens your prospects in UK as well. Plus the job prospects also become better here, right? So FRCR, you have step 1, which has physics and anatomy. So this can be cracked in your residency itself, like second year of residency. Then after residency, you can do the next step. So that's a must. And also I would like to add, because not many students know that when you do MD in radiology or MD in any branch, you just have to give a DNB exam, theory and practical. You clear it and you get a DNB degree also. Because that is what exactly I have done. I'll tell you honestly, when I joined MD, I did not know कि ऐसा कुछ होता है. Only after joining from the seniors, we got to know. So I think every MD should actually do it.
Absolutely. And I'll tell you, I talk to so many hospital owners. They are looking for, especially in the metropolitan cities. Dear guys, that it's a fact. I'm telling you with my experience itself, that hospital owners are actually looking for DNB graduates, because they know that MD, you can pass by so many ways, but DNB, you have to know the clinics to actually pass that examination. So in DNB, you are clinically very thorough, and that's a sure shot guarantee. So after MD, if you guys can very well go for DNB, it's a sure shot thing that you know the clinics to the core. So ma'am, we are talking about MD and DNB. So what is the core difference between MD and DNB radiology? And can you say that it is equivalent these days, or there is a slight mismatch still?
No. Absolutely, I would say that MD and DNB, especially in radiology, is equivalent, right? Rather, sometimes it might happen that doing MD radiology in a peripheral college versus getting DNB in metropolitan cities like Delhi, Mumbai, I would definitely prefer that DNB over MD radiology in a peripheral college. Because what we need to look at when a student is joining for the residency is whether the modalities are functional. Right? There's no point in doing MD जहाँ पे MRI है ही नहीं. Right? Rather go for a DNB where you get all the modalities functional. Right? I have done my MD, but then I joined in Hinduja Hospital, Mumbai post my MD. So there were DNB graduates. They were very good, right? They were very good. When I used to look at कि मैं resident में मैं कैसी थी और ये लोग कैसे हैं, they were very good, honestly very good.
So ma'am, we are talking about MD and DNB. So one of the most asked questions to me is कि what is the basic difference between MD radiology and DNB radiology? Because that's a very high ranked student who is getting the opportunity to choose MD or DNB, and if they're planning to take DNB when the MD is not an option, they are a little bit apprehensive. Now, I will ask you, what's the basic difference between MD and DNB radiology?
See, first of all, this question that we get, like you said, कि DNB radiology लेना चाहिए, नहीं लेना चाहिए. Branch always is the preference. Like if you are headbent on I want to do radiology and you're not getting MD, then definitely go for DNB, right? And especially in radiology, MD and DNB are equivalent, even like after that post-job prospects also, except for maybe in medical colleges. If you are looking forward, I'll join as an assistant professor, their MD is given preference over DNB, right? And in radiology, MD and DNB are equivalent. DNB in the good hospitals, you get good patient exposure because you have the best of the consultants in the best of the hospitals, so you get to learn. Because radiology is all about, seeing the scans, which you can do at any time of the day. So you don't have to be always, the patient does not have to be there, right? So you see the scan, you have the report which is reported by the consultant, like the best of the consultants in the hospital. You see the scan, you see the report, right? You can keep doing it at any time of the hour, maybe at night as well. So that is something I would like to suggest residents, like especially the DNB residents also. If you are not being taught academically there, but what you can always do is see the scan and the report and learn out of it. Like you rehearse yourself, if this is a scan that I would have seen, what would I give the report as? And then you cross-check seeing that what did your consultant report as? And that is where the maximum learning would happen, especially for the DNB candidates as well.
But do you think there is any bias towards the DNB residents when they're going for corporate jobs or government jobs?
There's no bias per se is what I would say. It's finally the skill, because you also have the option of DMRD. That's another query that we get. I'm getting DMRD, I'm not getting MD, I'm not getting DNB. I have again my co-residents, my friends who have done DMRD, who have done secondary DNB, and they're doing very good in life, right? So finally what it boils down is how confident you are in reporting, how good are your skills. Then everything else becomes very much secondary. If the employer who is trying to hire you, you give him the confidence, ek baar you can hire me and see how I'm reporting, and if he gets the faith, right, it works.
So are we saying that the diplomas, DMRD,
DMRDs.
or even there's a degree called CPS.
Yes.
That's also a degree these days in some parts of India. Do you think doing CPS radiology can also make you a skilled radiologist?
CPS, personally, I would not suggest anybody to take CPS, because you do not learn so much. But if you are like, nahi, mere parents radiologist hain, to mujhe radiology karna hi hai, and I'm not getting anything, then maybe you can just do it and then upskill yourself. But personally, there's not much of learning that happens there.
I think CPS also has lots of limitations in our country. Do you think the CPS will have a future in the upcoming 5 to 7 years?
I don't think so. I mean, never seen that so far. The job prospects are very, very less. That's what I said. If you're thinking, no, I want to just set up my own private practice, I have it already and I just want to go and sit there, then it's fine. But if job prospects, no.
What are the potentials for a radiologist in the corporate sector? What are the possible job options or setups that they can put to actually make the big bucks?
So there are multiple options which are there. You can just have ultrasound setup also. X-ray and ultrasound, that's a basic setup that a person can have. It's basic, but that's the one which gives the maximum returns. Because maintenance-wise, USD machine does not need any maintenance. So USD setup, for example, between 25 to 50 lakhs, you can get a setup done. There's no maintenance and it gives you huge returns because maintenance mein kuch nahi ja raha hai. But if you look at CT and MR, then the setup itself would require like 2 CR, maybe 2 to 4 CR is the setup that would be required, and then the maintenance that goes every month. So the returns that you get is not that much. So, personally for someone who's like, I want to make more returns with less investment, the ROI is much more with ultrasound for sure.
We would say that if we have to start a radiology setup, what is the minimum requirement? Capital and machines.
In terms of the finances, like
finances as well. Which machines are the least possible things that we require to actually start a radiology setup?
So the minimum that is required, like I said, X-ray and ultrasound is the minimum that should be there. And as you realize, now I'm getting good returns, you can always go on expanding it with next comes the CT and then comes the MRI. So, X-ray, ultrasound, CT and MRI. This is how the capital that is required for this setups goes on.
What do you think is the best place these days to start a radiology setup? Are you going to say it's a metropolitan city or the 2-tier or 3-tier cities?
The best is honestly the 3-tier city, right? Because Delhi and Mumbai, there's a lot of saturation already which is there, because everybody wants to have a good quality of life as well, right? So, but the 3-tier is the one where there's a maximum opportunity which is available. So again, we have friends who are staying in metropolitan, but they have their setups which is in the periphery. So they commute every day, like maybe for a 1 hour, 1.5 hour one way. So 2 to 3 hours goes in commuting. But they know that this is what is going to give me more returns. And this will help me to establish myself. In the metropolitan, there's so much of competition, so much of corporate hospitals. So there's hardly any room for an individual to start a practice.
True. I mean, it's highly competitive, and even if you want to start something, the area, the infrastructure is so expensive. The rentals are so high that it takes a lot of time to basically get break even, itself. There's always a fact or a myth about radiologists that they can work in several spaces at a single point of time. Basically, teleradiology has given you the power that you can teleconsult and yet work at other places. So is that a fact or is that a myth? And if it's a fact, how can a radiologist work at different places and actually manage everything so that, they can actually make the big bucks?
I mean, that's the one branch in a medical field, radiology, which gives us this power of working from home, working from a vacation, wherever you are, right? If we are talking about CT and MR, ultrasound definitely needs us to be on field, but CT and MR is something I can report from anywhere, right? Even right now, if I want, I can just go and report a scan. So that's how it is. And residents post MD or post their residency, they can get attached. There are a lot of teleradiology companies which are there, not just in India but abroad as well, right? You can report the scans which are happening in Africa, because that needs a lot of radiologists. Even UK based scans you can report being here in India, right? So now there's a timeline difference. UK ka time different hai, India ka time different hai. So you can definitely occupy your entire day getting attached to multiple companies like this. You give your time slots. This is the time I would be available for this, for this company and then this company. So you have a lot of freedom to do that actually.
I think that's the reason people call it the highest paying branch, but they don't know the reason. The reason is this only, that in a single span of 8 hours, a radiologist is able to work 7 to 8 different places and make diverse kind of money. And if the same diagnostician or surgeon is there, they have to work for those 8 hours at a single place, at a single income. So this is the biggest difference between radiology and other branches.
Yeah, and the best part is you are not needing any capital here. No
Absolutely.
investment. You just need a system which helps you in reporting.
So ma'am, again, it's a weird question, but since we are doing this exercise, that we are now asking our audience to put their questions regarding the subject specialist we have. So the question we got, I think the unique question of the day would be that is it viable? I won't say viable. Is it a good idea to take a radiology seat in a private college for between 2 to 3 crores? Now, is that a good idea?
See, again, I would say that this should be done by someone who has a radiology setup already, because parents are radiologists. So setup already hai. So he or she knows that in future mein, at least for the investment, for the setup, I would not need so much of money. My setup is ready. And that's why I want to do radiology, if that's the reason you are doing that. Otherwise, if I would be in that place, I would not do that, because again, like I said, any branch will give you good money if you are good at it, right? So just giving like 1 to 3 CR for pursuing your MD. Of course, if your pockets are big, you can do that. But then if you think in any radiology करके 1-2 साल में ये 1-3 CR मुझे वापस मिल जाएंगे, ऐसा नहीं होने वाला है, right? It's going to take you years basically to get that back.
I think even if the offers are coming in, the big offers, they're normally coming from tier 2 or tier 3 cities.
Very true.
Because I've seen a couple of my friends who have just done their radiology postgraduation and they got some crazy offers going up to like 8 lakh rupees a month. But
True.
the place is again some remote village, remote city in Haryana itself.
True.
So no, they are not willing to go from here to Haryana. So I think that's the one factor where I could see that, okay, radiology has big bucks.
So the what the residents or what many people actually do is, because now like if you're not married, just after your residency, like you are free, you are independent, you are living your bachelor's life. You go for some time, like to places like this, the peripheral places. You make money, right? And once you are like, अब तो family बन गई, अब एक जगह रहना है और अच्छी life चाहिए, then you come back to a place which is a decent, which gives you a good quality of life. And many residents actually do this, like they go to Middle East as well, because even that pays very well. You go after residency to Middle East, because tax bach jata hai wahan. So there are many advantages there. So you make money and then you come back, and there are ways to do that.
Ma'am, what would be your advice to a new JR1 joining radiology? How they have to, manage the stress, maybe the toxicity, and the whole radiology residency?
Yeah, this is a very important question, I believe, because when a JR1 is joining radiology is something that we do not have a lot of exposure in MBBS. It's like you are beginning another new journey altogether, right? But because we see that the top rankers take radiology. So if you go with that mindset कि मैं तो topper हूँ, मुझे day one से सब कुछ आएगा radiology में, ऐसा बिल्कुल होने वाला है नहीं. It might take you 2 to 3 months to get adjusted to what's happening in the department. I'll tell you my story that when I was JR1, अगर मेरे senior ने मुझे बोला कि MRI department में जाके वो patient का basically वहाँ से फिल्म्स लेके आओ, CD फिल्म्स लेके आओ कि प्रिंटर वहाँ हमने प्रिंट दिया था. तो मुझे ये भी नहीं पता था कि ये CT है कि ये MRI है. When I joined my radiology residency, because when I gave my PG entrance, तब इमेज बेस्ड क्वेश्चंस नहीं होते थे, राइट? तो हमने तो सीखा ही नहीं था MBBS में, ये भी नहीं सीखा था कि अच्छा ये CT ऐसे दिखता है, MRI. At least now the MBBS graduates, because they have to learn for NEET PG entrance, they learn कि okay, this is how CT looks and MRI. I did not know when I was in my first year of residency कि ये CT ऐसा है, MRI ऐसा है. I did not know in my first year of residency I was about to take a patient who was on wheelchair into MRI. Right? A blunder that I would have done. Thankfully, I was saved. I just joined the radiology residency. Thankfully, my senior came there. उसने देख लिया कि लेके जा रही, बचा लिया मुझे और patient को. Otherwise, the patient, would have lost life. Like, you cannot take anything metallic which is there into MRI room. तो इतना भी basic नहीं पता था. Right? So, what I would like to suggest is, please do not get overwhelmed when you join radiology. Everything will be new. It will take time to sink in. It might be very hectic if you are in a hospital which has good patient load. Have the faith that with time everything will settle down, and do not escape from the department. Right? कि समझ में नहीं आ रहा है तो मैं भाग जाऊँ, because that's the escape phenomenon that everybody thinks of. But what helps is staying there in the department. Having good relations with your senior, because those are the people who actually help you learn. Otherwise, you will never be able to learn radiology, right? Especially in government colleges, the faculties, they don't teach you much per se, right? वो report करके चले जाएंगे. But जो आपके immediate seniors हैं, JR2, JR3, उनके साथ relations maintain करना so that you learn from them is very, very important.
Ma'am, do you think radiology as a field in colleges has toxicity? Or is it, well, I have heard that it's one of the most chilled branches, but people still report that some kind of toxicity is still there. Now, is that true?
If I compare radiology with other branches, clinical branches, maybe let's say like medicine or surgery, definitely radiology is on a more chill side. But it's not as chill as the toppers think कि जाके मतलब सिर्फ आराम करना है, आराम ही आराम, ऐसा बिल्कुल नहीं है, right? You will have emergency duties. You might have it every alternate day as well. And depending on, what your senior has gone through when they were the JR1s, that is what, generally the next batch faces. So the toxicity comparatively is definitely less as compared to the clinical branches. But then, of course, like I said, it varies from institute to institute.
Well, I'll ask you a general question here, again about toxicity, because I think that's one of the most talked about topic these days. Students everywhere are now coming together and reporting that this college has high amount of toxicity. And we have seen that students have gone to the extreme step basically because they could not handle that. And that's one of the, I think, the worst scenario for the whole medical community. Ma'am, how do you think, and if any steps in your mind is there, where we together can actually help reduce toxicity for JRs in their own institutes? Because it is now measuring up to that the seniors are asking juniors to pay for their meals and, all the other expenses that are happening in the department, which is leading to people having zero income at the day and, 36-hour duty, 72-hour duty. These kind of inhuman things are happening. Now, how we can actually, help them reduce the toxicity and encourage our students to come together and, fight these kind of things?
See, one thing is, now we need to tell all the residents that they should be vocal about what is actually happening. And always remember that there's nothing more precious than your life.
Yes.
Right? Please do not take this extreme step, where your parents, your family later regret. Stress में क्या होता है ना कि हम ऐसी step ले लेते हैं, because we don't have that thinking capacity. So anticipating first is anticipating कि थोड़ा बहुत तो होगा, and with that attitude कि थोड़ा सह लेंगे, थोड़ा बहुत is what you cannot be always like egoistic, नहीं मैं जो बोलूँगा as JR1 वही होगा, वैसा भी नहीं होगा, right? So थोड़ा सह लेंगे, attitude is good. But at the same time कि बहुत ज़्यादा सहन करना पड़े, that should not be the case. When it is affecting your mental health, when it is affecting your functioning and performance, right, there should be, like let's say resident doctors की community है hospital में, where they know that this is my go-to group, कि जहाँ जाके I can be myself and I can report कि this is what is happening without being judged or without having any consequences. क्योंकि सबसे बड़ा डर ये होता है ना कि मुझे fail कर देंगे. See, maximum क्या होगा कि ठीक है fail कर देंगे, और क्या होगा, right? So think of the worst case scenario. Maximum यही होगा और कुछ नहीं होगा. But then, if you are vocal, that gives the motivation to others to get vocal about it. You know, the Me Too thing is basically that should start here as well.
Ma'am, students are normally, they, even if they try to be vocal, there's a lot of peer pressure which tells them that it's okay. Okay, this kind of toxicity is okay. We are trying to tell them that it's not okay. If you are feeling tension, if you are feeling pressured and, psychologically, if you're tortured, you need to wake up and you need to tell your people. Now, there are no people around them which can actually support them. I think people on Twitter are more vocal these days rather than people in colleges.
Very true.
So this is the point that I'm trying to, ask you, that how they can, have the courage to wake up and actually say that this is not right.
See, why Twitter is more vocal? Because you can post anything there anonymous.
Exactly.
You can change your name. When you are doing something offline, like मैं जाके कहीं बोल रहा हूँ, तो I am getting noticed कि इसने ऐसे बोला and coming to the notice. So that is where the students get scared, right? So again, helping them realize कि worst case scenario बस ये है, इससे ज़्यादा कुछ नहीं होगा. So making them realize that. And again, like I said, if we have a community which can be built in the college, outside the college, जैसे IMA एक association हो गया. Like you can have a dedicated association which basically helps them deal with this, where they can write mails. Like having a proper community association which we can actually do outside the colleges as well. So that can definitely be done. And having legal policies, I think the legal policies have to be there कि resident की duty इससे ज़्यादा नहीं हो सकती. Having the policy कि अगर आपके APs, आपके consultant आपको, they're not giving you that freedom to even do your basic course of the day, you can report it on this portal, right? Having the portals where you can report is the need of the hour, I believe.
I think that we need to even divide the toxicity in two parts. One is basically behavior driven. Now, behavior driven can be very, wide. It depends upon the kind of professor you are having, kind of seniors you are having. It can happen in government colleges, it can happen in corporate sectors. But there is a kind of legal policies which actually induce toxicity, which is basically prolonged hours of working. Now, this our government can actually take over and say no more than 10 hours or 8 hours of working. Otherwise, this 36 hours and 48 hours of duty, it sounds inhuman. आप कैसे सोच सकते हो कि एक आदमी 36 घंटे जागकर एक इलाज कर पाएगा?
Because this happens because seniors वही सोचते हैं हमने किया है तो तुम भी करोगे.
Yes.
That is one thing. And that's why if there are reforms which are happening, कि legally this is not allowed by the policy, I mean that has to be the change.
Absolutely, that has to be the change. They need to put in some specific working hours. We can understand the kind of emergencies every branch has. Being a doctor, people have to, go through the emergency part also. But that has to be restricted to like one night a week with a compensatory holiday in the upcoming week or something like that. Just like corporates. We cannot expect our doctors to work mindlessly, and then if I look into the pay scale also, we can very well say that, okay, that pay scale, they are not being evenly, accurately paid. Okay, मिल रहा है. ठीक है, मिल रहा है. बट जितना काम करा तो उसके हिसाब से कुछ नहीं मिल रहा. That I absolutely agree.
Very true.
So ma'am, my question to you is that now let's suppose a radiology resident starts his journey, everything is going fine. Ma'am, where do you think that after 20 years of his life, where should an educate career chart should lead them? See,
the options are, like I said, after MD, first do a senior residency, which pays you like around, currently it is 90K to 1 lakh. It varies from place to place as well. Like I was in Mumbai, the pay scale is comparatively less if you compare it with Delhi. Delhi pays more. So, but senior residency is the first thing. You do it for a year or a two, depending on how much you want to learn. Then comes, I would personally say that, कि हाँ ठीक है, job कर लो again as a independent consultant. You can do it in corporates, and there the pay scale is, to begin with, is 2.5 is the minimum. Then it can go up to 5 as well. And like we said, in tier 3, it can go to any amount, like 8 and 10 also. And once you have done that, again, you have the confidence ki I'm very good with my reporting. I can do it independently. Then comes, okay, I'm setting up my private. You can do it individually, or if you think कि इतना capital नहीं बन पा रहा है, it's a lot for me to do it individually, you can have 2-3 radiologists coming together and then getting a setup done. Like you can have someone who specializes in ultrasound. You know, you divide your functions as well. कि आप ultrasound करोगे, मैं CT में MRI. So that is how the work also get divided and your capital also gets divided. And once you have done that, like when you have your private setup, sky is the limit on how much you are earning, right? Like I said, I have a friend who's earning 30 lakhs and he's doing it individually, right? And then once you are like, yeah, बहुत हो गया radiology, it's 10 years, 20 years down the line, the same setup, you can give it to the new radiology pass out residents who are coming in कि आप हमारे center में आके सिर्फ job कर लो, you know, we'll have a share of whatever the revenue is coming. So the retirement also, if you're thinking any time of that, even that's easy, because not everybody can put up a practice, a setup. If you are giving them a ready setup, anybody would be more than happy to come and work there.
I think that's one of the best answers of a career graph I've got till now in every of my podcasts. So thank you so much for that.
Thank you.
And now we can proudly say that radiology has big bucks. So ma'am, let's move to the NEET PG segment now. You are one of the most favorite faculties of our students. So right now, 2025 NEET PG is around 5 months now. Ma'am, what would be your advice to the students? First, the kind of students who have not done anything till now, they want to start. Do you still think they have a chance?
Absolutely, yes. I still believe that it's in mid-June. We have NEET PG 25. So we have good enough time for anybody who starts now. The only thing that they need to take care of is the smart work. I would honestly say that please don't go behind just the hard work. If पढ़ रहे हैं, slogging कर रहे हैं, that's not going to give you a rank. You need to know what needs to be done, right? So I always talk about the 4 pillars that help you in crack this exam. First is working on your concepts. Then I'm a die-hard fan of mnemonics, right? Easy tricks, आपने concepts पढ़ लिए और उसको याद कैसे रखना है ताकि exam में even if you lose out, right, panic हो गए, mnemonics come to your brain very reflexly to help you remember that. Then comes the MCQ solving skills, because you would see that a university topper is not always a NEET PG topper. The MCQ skills are something which are very, very important. And then comes, you have done all of this, revision. सब कर लिया, do not go behind just the quantity, go behind revision, quality, right? Revising it day in and day out. So these are the 4 pillars that need to be catered to.
What would be the 6-month strategy for a student who has been preparing for almost a year now?
So the 6-month strategy first is your first read that you would do. Let's say if somebody is starting now, for example, like agar aap pehle se bhi kar rahe ho, but now you're like, I want to get everything at one place. So the first thing is 6 months I would like to divide into, let's say 3, 2 and 1. 3 months, 2 months and 1 month, right? So 3 months mein, if yet you have not got all your material at one place, you are using multiple resources, right? That's what we have these days. So getting everything of one subject at one place, so that you know that when I'm in next 2 month cycle, this is the one place I'll go for one particular subject. So first 3 months together, everything at one place, which includes the theory videos, which includes solving the PYQs, mastering them, highlighting them, right? All of that. And then comes the second read, where again you are going through all that you have gathered at one place, with giving more focus on GTs now, more frequent mock tests and GTs which you have to give. And finally comes the last month where you're focusing on your weak areas more.
How to basically counter this habit of lucky guesses? I have seen so many students, marking 200 questions just saying that guess hai, tukka hai, lag jayega. And it actually leads to more negatives than positives. Now, how to counter this habit?
I think this is like you are going to play a match. तो आप डायरेक्ट जाके मैच नहीं खेलोगे. So you have to do a lot of net practice पहले करना है मैच के पहले, and that basically comes with giving a lot of mock tests and GTs. So give a GT where you give a GT without doing logical guesses. Give a GT where you're attempting all 200 with the tukkas that you have, and see that where you are performing better, and that will give you a good idea कि what is working in my favor.
How to best attempt a grant test, because that is one thing which students are always running from. कि कल देंगे ग्रांड टेस्ट, परसों देंगे ग्रांड टेस्ट. So how to best attempt a grant test?
Again, knowing that only with the GTs you would learn time management. Otherwise, exam में even the best of the students, they because we tend to overthink in exam, so time कम पड़ जाता है. So when you are giving a grant test, for example, if it's 3.5 hours, start with, like, let's say I'll finish in 3 hours 15 minutes, then come down to 3 hours, because whatever time you're taking for a grant test, exam में definitely उससे ज़्यादा लगता ही लगता है, तो वो buffer आपको देके चलना है, right? And when you're giving a grant test as well, give it like you're giving a real exam. कि वही conditions में best is to give it on a laptop or a desktop, जो exam में भी होगा. You get the habit of clicking. We have had students who have said that कि exam में सिर्फ वो mouse के click से भी disturb हो जाते हैं. So if you can give the grant test with that, कि laptop है but साथ में mouse है, actual conditions that would be there, ki you are not getting up from your chair till the test is over. So giving it like a real exam scenario and giving it like this is your final exam. Because that is where, like you said, logical guesses तुक्के grand test में तो हर कोई कर लेता है कि इससे क्या ही फर्क पड़ने वाला है rank में. But real exam में you struggle. I have basically faced it myself when I gave my All India PG. And to tell you that I have not done any coaching per se personally. Only thing that I had used during my thing was Bhatia test series. That's it. So I have been a Bhatia test series student. I just used to give the mock test, right? No test discussions, no offline classes, nothing. So टेस्ट में आई ऑलवेज यूज टू बी अमंग्स लाइक द टॉपर स्टूडेंट्स. वो जो ऑल इंडिया रैंकिंग आता था तब, वो तो तब ऑफलाइन भी होता था, है ना, आपको OMR शीट में मार्क करना है. तब तो मेरे 300 क्वेश्चंस जो हैं आधे घंटे पहले खत्म हो रहे हैं. बट जब मेरी रियल ऑल इंडिया PG एग्जाम हुई, मेरे टाइम प्रॉब्लम नहीं था, बट आई जस्ट अटेम्प्टेड 240 आउट ऑफ 300. आई मीन, कैन यू इमेजिन, लाइक 240 out of 300. And I had my friends who were my competitors come friends who attempted 295. So the game was all lost there. Because you overthink in the exam hall. Because every question is your rank decider. So give GTs like the real exam.
A point where students get stuck is during the last days of revision, when they give grand tests and they do not get a good rank. Now this is where they get super demotivated. And especially I think this is the right time for that kind of demotivation to set in. Now how to counter that kind of mental mindset?
Again, I've spoken to so many toppers and I always ask them, what was your first GT score, what was your final GT score, and what was your real exam score? We have had toppers who have got very good ranks like in 100, 200. Their first GT score when they began was only 80 correct. Their last GT score was like 150 correct. In the real exam, they got 170 correct. So understanding that, this happens in reality. You will begin with 80 correct, but then you have the potential to reach to that 170 correct if you do not get demotivated. Remembering that story of the rabbit and the tortoise, right? It's not the rabbit who won the race, it was the tortoise. Because slow and steady wins the race. If you lose you leave the ground, you lose the match. Stay on the ground, knowing that I can hit a 6 even in the last ball. That's my final exam. That's very, very important.
True. You have seen that there's a new pattern of tests in the NEET PG, the segmented wise. Now, any tips how to best attempt that kind of exam?
Yeah, true. I mean, the sections has come in all the exams, be it NEET PG, be it INICET, be it FMGE. Just that the timing and the number of questions are different, right? So everybody has exam now in sections. Personally, I believe it's a good thing, right? क्योंकि उसमें क्या होता है ना, one section खत्म हो गया, you have no chance to go back to it, right? So you are not carrying any baggage कि मुझे वापस देखना है, मुझे time चाहिए. So that's the best part about it. But then what happens is, I've seen it personally, आपके initial sections difficult होंगे, आपका last वाला section easy होगा. So if you start thinking, oh my God, the entire paper is difficult just because my section 1 is difficult, you would lose the game again. So understanding and anticipating that maybe my initial sections will be difficult is very, very important. Again, practice. Like, all the apps give you that custom module thing where you can have a timer as well. So practicing with those number questions in that much time is the need of the hour to be, practice as those many sections.
Ma'am, what's the main difference between the question pattern in INICET, NEET PG and FMG? If you have to basically equate all of these, what kind of questions would you say come in all the exams?
So if I talk about INICET, it focuses more on first and second year subjects. We have seen it for sure. Then if I talk about NEET PG, it's a mix of both. You get one-liner questions also and clinical questions also. And FMG also these days, interestingly, is very, very good, right? The questions are so good that I recommend NEET PG students to do all the FMG previous year questions. We have seen a lot of overlap between FMG, INICET, FMG, NEET PG. There's a lot of overlap. So when you solve all these PYQs together, you get an idea that what are the topics which are examiners' favorite these years, recent years mein, right? So I think all the exams are now coming to the same level, which is more moving towards more of USMLE trend, more of clinical questions, like the long stem questions, image-based questions.
So ma'am, as you know, the exams are now overlapping majorly. INICET and NEET PG are going to happen in a 1 month gap. So the students who are preparing for NEET PG, would you recommend that they should give INICET as well in the May?
Absolutely, yes.
And what do you think is the best strategy for them?
INICET, every student who's eligible to give INICET should give INICET, because maybe you might think कि मुझे क्यों देना है, मुझे पता है कि मेरा होने ही नहीं वाला है, पता है कि नहीं होने वाला है, फिर भी दे दो, because that's the best mock test that you can give before the NEET PG, right? The real exam condition. Like I said, if I would have an opportunity to, before my AIPG exam, to give a mock test like this, like INICET something, I would have not done this mistake. So you will realize what mistakes I'm doing in the exam hall, what is disturbing me. So all those you can prevent in your major match, which is the NEET PG, if that is what you are targeting, right? And if you are like, you know your capabilities. If you think that nowhere I can crack INICET, this is not my game. So do not change any strategy. Just keep focusing on your NEET PG timetable that you have, that you are following. But बीच में INICET एक mock test जैसे दे दो. But for the students who are serious about कि no, we have to give a serious attempt on INICET, focus on first year and second year and all the PYTs of INICET. They repeat a lot.
Thank you so much, ma'am. And I think, ma'am, my last question of the day is basically again about your life. Apart from being an educator, apart from being a radiologist, you are also an entrepreneur. You have started your own venture, and I believe it's really doing very well, the MedSign apps. All right. So I'm not going to talk about the product, okay? But I'm going to talk about that journey, that why, because you were an established faculty when you started that thing. Why did you start it? And how did you scale it up?
See, basically, I started it because I'm very, very passionate about making the mnemonics, which I call Nickmonics, right? Nikita's mnemonics. And I cater not only to radiology. I was very established as a radiology faculty, but then I wanted to venture out into all the subjects, helping students learn that how studies can be fun too. Not just making mnemonics, which are ABCD, but then the story mnemonics, which stick with you for lifetime, not just for your entrance exam. So, and I think because majority of the platforms have an issue with, oh, you cannot teach any other subject. So I was like, let me do it on my own. And because I am true to it, I'll give my best. I know that it is going to work for the students. So I started that, and thankfully by God's grace, it's doing very, very well. And, you know, I would like to take this chance to thank my husband, right? Because it's not just me, it's me and him, Dr. Hitesh Nathani. We, both of us are doing it together. Major of the back-end stuff, he's handling. Content stuff or the face is me, but he has been the major support behind it.
That's great. That's like a power couple, you know, taking over the market. That's really great.
Thank you. Thank you so much.
But I will say that was the second last question. The last question is this. This is the Predictor series that we are running here. And we basically ask you that which 5 branches in the upcoming future, next 10 years, do you think would be having the highest potential in the market?
So if I have to talk about the branches which have a huge potential, radiology, particularly interventional radiology, is what I see has a good potential. Then we have women's imaging in radiology. And then we have oncology, right? Medical oncology, because we are seeing so many of, the cancer incidents being increasing. So medical oncology, radiation oncology, right? And maybe I'm seeing that somewhere down the line, we will just have cancer clinics be starting up everywhere, because this is becoming like so common. And then we have urology, right? Again, which is a good branch.
Thank you so much, ma'am, for such brilliant insight towards the whole medical world, radiology, NEET PG preparation. But this is not the end. We are moving towards the rapid fire round. We have got some very interesting questions for you. So very simple rule, 2 rules. 1, you have to be super spontaneous with us. And second, you have to be super truthful. So are you ready?
Yes.
Perfect. Who has been the biggest inspiration in your life?
My mother.
Who is a better dancer, you or your daughter?
For sure, my daughter.
I think on behalf of all the audience, we love your reels, we love your daughter, and we love the way, the way she happily dances. It's absolutely brilliant.
Thank you. She has started giving me the complex now. So I've started making individual reels. Koi comparison nahi hoga.
Most happiest day of your life?
I still remember in my 8th standard when I was All India second in National Cyber Olympiad.
Acha.
Why? Because, see, you are the most happiest when you get things which you expect the least. When you have put in efforts and you do not get the results, तब दुख बहुत ज़्यादा होता है. जब आपको चीज़ें मिलती है जो आपने expect ही नहीं की, तब खुशी बहुत ज़्यादा होती है. And that was one of that kind. बस देने के लिए exam दे दी थी और All India second आया, दिल्ली बुला के president prize दे रहे हैं. I mean, that's something which is.
So you have been a through and through topper from day one.
हाँ, क्लास में सेकंड रैंक भी आता था तो मम्मी को नहीं चलता था.
If you had a day off, how would you spend it?
Shopping, typical girl thing.
Ah, nice. What's the last thing that you have purchased?
Last thing, so many clothes. Like right from H&M to West Side. I mean, I'll be very honest, the sale season is on, right? December. I've been almost everywhere.
Ma'am, what's your favorite comfort food?
See, anywhere I want an instant kick, kuch meetha ho jaye, Dairy Milk comes to my rescue. Instant one.
So you live in Surat, Gujarat. What's your favorite food in that city?
Surti Locho. That you would not get anywhere else.
What's that?
It's basically like a half-cooked khamar,
Okay.
basically, which you get with awesome chutney. So you need to visit Surat for that, for sure.
I would surely visit that.
Yeah.
I visited that place once and I found that the food was so vast there and everybody's just crazy about food.
Absolutely. I mean, Gujaratis live and enjoy their life to the fullest. We absolutely love that.
Well, what's the one thing you have learned from being a mother?
Patience.
I'm sure.
Yelling does not work. Right.
So, ma'am, with this, we come to an end. Thank you so much for being such a sweet guest. Everything you have, said to me, conversed here, had a brilliance to it. So, I'm very thankful for being a guest. And I'm really, really happy that we had such a wonderful podcast. Thank you so much, ma'am.
Thank you. Thank you so much, Dr. Nachiket, for this opportunity. The pleasure is all mine. And I hope this helps our audience get those insights that we wanted to share with them.
Absolutely, ma'am. And I would actually share that we already had a podcast regarding radiology with Dr. Rishabh. But today we had a very new outcome towards radiology. So I think these two, I can really say that I was expecting the questions to be repeated, but you were absolutely brilliant. You gave us a very new outcome. And I think on behalf of all the audience, a real great thank you to you.
Thank you. Thank you so much. Always there.
And thank you so much, everyone. I believe, again, I would say, repeating this thing, it's a brilliant conversation today. We have covered everything regarding radiology. And my favorite part was that the setup can be managed under 50 lakh rupees. If you're applying to become a radiologist, have your own setup, this is the minimum capital you require. I think that's one of the most, ground level knowledge that we require to actually grow in this field. So thank you so much, everyone. And as usual, before you leave, please subscribe, like, and share. And who do you want the next guest to be? Please put it in the comments box. And if you want to help me, do drop a message to that guest. Please come to the Nachiket Bhatia Show. Thank you so much. God bless you and best of luck.